Welcome to Dr. Brumfield's Elite Athletics. I am Dr. Brumfield, and today we're here with Jessica. And Jessica is coming in because she's having some problems. So what's going on, Jessica?
I've been having shoulder pain for almost a year.
Okay.
It's constant. I would say about 3 to 4 days a week it hurts.
Oh, wow. Okay.
It limits my range. I can always lift up my arm. The pain radiates to my neck and to the front of my clavicle.
Okay.
Yeah, and it just affects me when I'm sleeping, taking off my clothes, just to think of my arm.
Oh, wow. So when's the first time you noticed it?
I noticed it when I was laying down, maybe at the beginning of the year.
So there's no one incident that may have started that, so it's
No.
just been naturally progressive?
Yes.
Okay, on a scale of 1 to 10, 1 being no pain, 10 being the worst, what number would you give it?
At its worst, I would say 8.
What is it right now?
Right now, it's about a 5.
5. And describe it. Dull, achy, sharp, tingling, stabbing, numbness. How would you describe the pain? So we got some radiation going up, and we got constant. What else?
Yeah, it just feels very tender.
Okay.
Sometimes a burning sensation.
Burning. So
It's very tender.
Can you pinpoint where it is?
So here,
So there?
here, exactly here,
Okay.
and right here.
Okay.
And then it feels tender going up this side of my neck.
Okay. And so, do you have headaches?
No.
No headaches at all? Okay. So what we want to do is, let's just bring your arms all the way up to the side, all the way up, palms together. Is that the highest you can go?
On this one, yes.
So this is it.
Yes.
Okay. Now, let's go ahead and bring them down. And let's bring them in front, and we want to go up as high as we can go. Okay. And bring it down. Now, I noticed when you got to that certain point, you start to grimace on your face. Is it because it was pain?
Yes, and it cracks.
Okay. So let's take this hand and place it on your shoulder and bring it up and down like this. Good. Good. No problems there. Let's bring that one down. Let's do this one.
It feels very tight.
Okay. Now, where is the tightness? Is it
Right here.
still in there? Okay. Let's go ahead and bring it down. So what I want to do is, let's bring your arms out to the side. I want to push down, don't let me. Ready? Good. I'm going to pull forward, don't let me. Good. I'm going to push back, don't let me. Good. Bring your arms all the way out in front. Wrist up. Hold, don't let me pull down. Good. Good. And wrist down. And hold. Good. Good. And then spread your fingers. Don't let me close. Good. Good. So basically what, okay, put them down. So basically what I was doing is checking your muscle tone. You know, we grade muscles in terms of 1 to 5. 5 meaning you can hold the contraction and against resistance. So your muscles there pretty good. As well as your tone is pretty good as well. So now what I'm going to do is I'm going to step behind you. I'm going to do some muscle tests. So what we want to do is we want to rule out whether it's a bone or nerve or all of the above. Okay?
Okay.
So I'm going to place my hands on top of your head. Any pain?
No.
Good. Any pain here?
No.
Good. Any pain here?
No.
Perfect. How about here? Any pain?
No.
Nope. So you'll notice that Jessica has just taken off her tank top, and one of the things that I noticed was she has trouble taking off her shirt. So I had asked her, I said, you know, how do you get dressed? And what was your response?
I get help from my mom.
So she has to get help from her mom. And so we know there's obviously a problem, and sometimes what happens is things like this can set up without any known cause. And so what we have to do is try to figure out what the cause is. And so what I'm going to do is I'm just going to start palpating, touching the joint. Go ahead and relax. I don't need any help. And so, yeah. And so as you see, I'm palpating the GH joint, which is the glenohumeral joint. And there's already tenderness, you can see it on her face. And there's a little crepitus, meaning it's popping back and forth. Okay. So as I palpate her upper traps, they are rock hard. So I'm assuming you work out quite a bit. Yes?
Sometimes.
And so with that, if we have an area that's not functioning properly, sometimes if we keep working out on it, it'll increase our injury or our pain or our dysfunction. Hold here. Good. Hold. Hold. Good. Hold. Good. Hold. Good. Hold. Yep. Hold. Good. Hold. Good. Yep, I'm sorry. Hold. Good. And you can let down. Okay. All right. So I want you to try to relax as much as you can. And so what we're going to do first is we're going to try to work on the pec major, the tail of the breast. And so what I want you to do is to breathe in through your nose and out through your mouth. And I'm going to slide your breast down to expose the muscle. There we go. So the deeper the pain, the deeper your breath should be, okay? So inhale through your nose and out through your mouth. Good. Let me know if you need to take a break. You okay?
Mm-hmm.
How does it feel?
It feels very tender.
Yeah. So you never thought to get it checked out or anything? You just figured it was going to go back to normal?
Yes.
At least you're honest. All right. So I'm going to pull you down again. So keep breathing for me. In through your nose. There you go. And what I'm doing is I'm loosening it up before I use the muscle stripping tools. I want to try to break up the adhesions with my hands before I use anything else. You notice I'm focusing right here because this is the most area, the most tenderness,
yes,
as well as tightness. And move your arm a little bit. How does it feel? It should be a lot looser.
Oh, it is.
Yeah.
It is. I didn't even know I had pain here. I thought it was just up here.
Yeah, no, you have a lot. So now what we're going to do is we're going to open this arm. Just lean it right there. Now, you notice you can't even let it hang, right? Because you're feeling the pain. So that's what we want to work on. So you can leave it right there. Sorry. And remember, you were complaining of the clavicle pain, right?
Yes.
And so those muscles right along the clavicle have locked up. And so we're trying to get you some more room from there as well. I'm sorry, keep breathing for me. There you go. Keep breathing. Keep breathing. I'm sorry. Let me know when you need a break as my phone goes off. Sorry. There we go. Keep breathing. Now I'm just going to step back. Now you see your arm, right? It's already going lower.
Yes.
And we haven't stretched or anything. So now what I'm going to do is I'm going to use the muscle scraping tool to kind of elongate it. So now I'm going to pause really quick. That was another patient. So we're going to do it in steps.
Okay.
Be right back. Oh, no, the phone is right here. Right here. All right. All right, so now we're going to start with the stripping. And again, I'm going to apologize first for the discomfort. But your pecs, you sit at a desk a lot? What do you do for a living?
I'm a speech therapist.
Speech therapist?
I do sit a lot.
Okay. Computer?
Yes.
Yeah, and so basically, you know, one of the things that we find for people that are sitting at the desk, their shoulders roll forward because of looking at the monitors and everything. And so I'm just gonna strip. I know it's not comfortable. So this is gonna leave a red mark on you, okay?
Okay.
Just to let you know. Keep breathing for me. Keep breathing. You okay?
Mm-hmm.
Feel how crunchy that is?
Yeah, I feel it.
What we're trying to do is get all of that to kind of relax.
Feels very bumpy.
Yeah. See how this is smooth now? And we want to get everything else the same way. And we're getting there. So now we want to work on the deltoid here, because we had some tenderness in there as well. So we just let it hang. Keep breathing. Oh, you're feeling that, huh?
Yes, I feel it.
All right. I'm sorry. And the nose out the mouth. Yeah, right here. Yeah. That's really tight. I'm gonna go a little deep. You feel it pop?
Mm-hmm.
You're just starting to release. Keep breathing for me. I'm sorry.
Very tender.
Yeah. So generally when you go to the gym, what are you working on?
A little bit of everything.
Okay.
Yeah.
You do a lot of arms and chest?
Not so much chest. And arms, it depends on my range of motion that day.
Okay. So you've had a problem with range of motion for quite a while. Because I know you said it depends on the range of motion that day. So that means that based on your pain determines or dictates what you work on.
Yes.
That's not what working out is about.
Yes. And what side am I going to sleep on too?
Oh, okay. Yeah, we got nothing right there. So just relax. work on the upper trap. So we're basically working on the whole shoulder girdle. So we're working on the front or the interior, the top, the side, and then the last we're gonna work on the back. But we gotta get this trap right here because it's so tight. Don't forget to breathe. You got saved by the bell. It's not this recording, but that's a patient of mine who has been a patient of mine for a long time. And she had a breast removed from breast cancer. And the cancer came back, she's stage 4. So she's leaving now to go get treatment in TJ.
Wow.
So I told her I'll see her in a bit. I'm gonna go by and see her before she leaves.
Yeah, wow. That's unfortunate.
So we're just going to keep going through the trap. Now you notice I haven't done anything that's super tough or aggressive because we're dealing with the soft tissue. We need to address the soft tissue first in order to make sure that the joint can move properly. If the soft tissue is not addressed, then everything is going to be lost, if you will. How are you doing?
Good. Good.
So I want you to turn your head to the left for me. There you go. And that's just going to help stretch this out. And then I'll be able to get most of that when we turn you over. Okay, so let's see where we are. I'm gonna just let your arm go. Just let it drop. Okay, so it's, before it was here, now it's down further.
Yeah.
And then what I'm gonna do is I'm gonna stretch it a little bit now, okay? So I want you to take a deep breath. And when I say go, I want you to push your arm up, okay? Here we go, ready? And go, push up to the sky. Push, 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 push. Relax and let it go. Perfect. Good, keep breathing. Deep breath, push up. Push, push, harder, push, 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 relax, let it go. Good. You notice I'm cheating a little bit as you push up again. I'm also stretching, pushing towards your head. I didn't tell you I was going to do that though, huh? All right, lift it up for me. Bring it up. And then bring it back down. Let's see where it's hanging at now. See the difference?
Yes,
So
I feel the difference too.
What do you feel?
I feel a lot less pain.
Okay, good. And so now what we're going to do is you're going to pull forward, okay, from this position. Deep breath and pull forward. Push, 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 and relax. Yeah, this side's tighter. Keep breathing for me. There we go. Deep breath. Push forward. Push, 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 and relax. Let it go. There we go. Now this is a tough stretch. It's tight. I'm already at the end. Now I'm going to move towards your head. There we go. Deep breath. And push for me. Hard as you can. Push up. Push, 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 push. Relax. Let it go. There we go. I know. Good. Let's bring it back. Now let's move it around. Let's see where you are. No tears so far, so we're doing good. We're doing good. So let's bring it out to the side. Let it hang. Much better. Okay. And let's bring it up to the top. Yeah. Perfect weight, Aaron. Good, good, good. So I feel a little bit more tension. I'm gonna push down. Uh-huh. Did you feel the joint just pop?
Yes, I did.
Deep breath. So now you're gonna push towards the ceiling. Ready? And go. Push, 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 push. Relax, let it go. Perfect. Again, deep breath. Push up. Push, 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 push. Relax, let it go. And deep breath. Push up. Push, push, push. Relax, let it go. And so that pop that you felt was your clavicle that I adjusted without you even knowing. I had to get the muscles around it to relax.
Oh my goodness.
So what do you feel?
My arm feels so weak right now.
Yeah, because we've elongated the muscles, right? So what we're gonna do now is we're gonna turn you over and now we're gonna work on the back. So now we're gonna work on the trap. And then before we do that, let's see what the scapula is.
Ooh.
And so that's tight as well. Now where are you feeling that? In the front or in the back?
In the front.
Here?
And on top.
And top. Okay, that's right where we're going. Okay, good. All right, so again, breathe for me into your nose, out through your mouth. There we go. Can you feel all of that?
Yes.
As I'm sliding over knots and popping. And see, there's no way that we can do the front and not do the back because they work together. Keep breathing for me.
Ooh, very tender there.
Yeah, right here.
Yep. Yep, exactly right there.
Mm-hmm. So I already apologized though, right? Okay. Now let's take this arm. We're going to bend it just like that so we can free up this whole area of the scapula. You have a lot of adhesions right in here. I'm sorry. Ready?
Yep. Let's do it.
Uh-oh. Oh, okay. Sorry. Usually I have tears. This is the first for laughter.
It tickles, but it feels tender.
So what would you say your pain tolerance is? You have a high tolerance for pain or?
So.
Okay.
I would think so, since I waited so long for it to be treated.
You know what? That's true. Okay. open it for me. There we go. I'm just gonna go forward with it to open it up. Let me take off my watch. I want to get into the space. Adjust the camera really quick, the table slid. We're gonna lower this hip piece. There we go. So now I'm gonna start adjusting. The areas for you have some rib pits. I want to do those first. Deep breath and out. There you go. Deep breath and out. Good. So the area that we're adjusting, when I say rib pits, that's where the rib and the spinal cord meets, right? And so you have little bitty small joints that of connection. And so sometimes those can be, they'll pop out and can become inflamed, which is what you were dealing with, which is why I had to bring your arm back to go right in front of the scapula. Relax in here. I'm going to rotate your head. Good. Perfect. Good. Good. Now, one thing that I do want to see. Okay, so I'm gonna have to slide you down a little bit. Put you at an angle. So we wanna take care of that atlas. So let's turn your head this way. Yep, lift up for me. I'm gonna slide my arm right underneath and just relax for me. There we go. Straight down, good. And now it's opening up other things that wasn't there before. So now we're gonna relax, rotate. Okay, turn over on your back. And slide you up. And relax. Relax. Good. And relax. Relax, drop. Good. Another decompression. Many people use the Y strap, but we can do the same decompression with our hands. Just relax. How was that?
Wow.
All right, let's get you up for a bit. Turn this way. Still tender, right?
Yes.
Good. Now what I'm going to do the last thing, so remember you have marks that's going to last about 3 or 4 days up to a week. But I'm going to cup your shoulder. I want to do sort of an internal decompression. And what we want to do is kind of decompress the shoulder girdle. To give you a little bit better range of motion and functionality. How does it feel?
Feels good right now. Well, my skin feels tight.
Yeah. But it's not painful?
No.
Okay, good. Gotta get this upper track.
Looking a little crazy.
Yeah. But we gotta, there we go. And small one. All right. So we're gonna let that sit for a little bit.
Okay.
No, I got one spot I missed. Now we're gonna relax it.
It feels tender there.
Yeah, so basically the way the cupping works is, like most therapies, it goes from the outside. If I touch you, right, I'm touching from the outside and it's going in. With the cupping, it's going from the inside out. So we're drawing the stagnated blood, some of that quote unquote inflammation out to the top. So I know you can't see it, but you'll notice that once we take the cups off, certain circles will be dark red to purple, versus some you will never be able to tell that a cup was even there. That's because the inflammation is in that particular area, that joint. So you notice the first one that I placed was right here at the GH joint, because that's where most of your tenderness was. So we want to kind of remove all of that out. And even with the adhesions. The other thing is you're a meat eater?
Yes.
So have you ever cleaned raw chicken?
Yes.
Okay, so you know if you peel the skin off the chicken, right, there's a thin translucent layer around the chicken, around the meat. That's called fascia, right? And so what we're doing is we're loosening up that fascia as well, because that fascia can also cause pain and tenderness, right? And so that's what decompression does. So we're kind of loosening up everything. I need to put one more there. Loosen up your whole area, and then in a few, about a minute or so, then we're going to start with range of motion. And so it's going to be really, really tight, but you'll notice when we're done, it'll be completely different in terms of your range of motion. And then I'm going to adjust the GH joint, and then we're done. Okay. This one's very red, as well as this. So we have a good range and coverage of that GH joint. So what I want you to do right now is, if you can look at me, just raise your arm up and down. Yeah, just hold it there. Just
will it pop off?
It's okay if it pops off. So we want to do it 10 times. Nice and faster. There we go. Up and down. There we go. Okay. What are you feeling? Yeah.
Kind of, it's cracking a little bit.
Okay. Keep working it. We want to also recruit this shoulder blade just to come out as well. So bring it up higher. There we go. Yep, and down. Now go from here, up and down. Yeah, there we go.
As high as I can?
Yeah, as high as you can. Good. Yeah, there we go. 10 times, really fast. Good. Good. Don't worry about it falling. All right, now we want to go across this way. Across the front. Yep, really fast. 10 times. Yep. Come all the way out to me. All the way. There we go. All the way out. Perfect. Let's go. Yep. Good. Yeah, keep going. Yeah, keep going. Yep, and then now we want to make big circles. Yep, perfect. A little faster. There we go. There we go. Perfect. Yep. Perfect. And we are done. And that is it. So let's take them off. Just go ahead and relax your shoulder. So you see, as we leave them on, there's going to be different ones that are going to stay. So what do you see with the circles? Can you see the degree of color?
Yes. There's some purple spots on some of them.
Now, your most purple spots are here, here, definitely here, and here. So what I want you to do now is just move your arm around. Surprise, right? All right. So tell me what you feel. I mean, the smile says it all, but tell me what you feel.
Yeah. It's pretty freeing.
Okay.
Yeah. Feels good.
Now let's go side to side. Yeah.
I have a lot more range now.
Okay. Yeah.
Yeah,
Let's bring
definitely.
it forward.
It feels a little tender, but I have a lot more
Well, it's
range.
going to be tender
Yeah.
because a lot of the work that I did was right here. All right, so what I want you to do is hold this one right. I'm going to adjust the shoulder.
Okay.
Let's see. So hold it, grab it. So we're going to do, oh, that one quit too. See what I mean? I knew it was coming. Okay, right there, quit. So now we want to adjust this shoulder. So let me have this arm here. Just relax it. Let me grab your towel. And shoulder up. There we go. How did that feel?
Feels good.
Now move it around. So what's the difference before the adjustment versus right now?
I can kiss my arm now.
Right.
I couldn't lift it up before. It was very painful.
Right, and so now, where would you rate this before, and where would you rate it now? Before treatment and after treatment, as you see, you're still moving it around.
Yeah.
You can't believe it, huh?
I can't. I'm even now on both sides.
Yeah, you are.
Yeah. At the beginning, it was probably like an 8, 9.
Uh-huh.
And I would say it's a 2.
We have officially helped Jessica improve her range of motion, decrease the pain. but most importantly, got the smile back without the pain. So anything you want to say before we close?
I feel a lot better now. I feel more free. I have my range of motion back, so thank you.
So remember, if there's a topic that we have not created a video for, leave us a comment. We read them all and we can respond there. If you need our assistance, go to our website, DrOhMyBack.com. Until next time, bye-bye.